If your ankles swell so much by evening that bending your foot feels like trying to fold a water balloon, stop calling it just swelling. I'm not talking about a little puffiness after sitting too long. I mean the kind of tight, shiny skin that looks stretched to its limit. The kind of heaviness that makes your legs feel like they're filled with wet sand. The kind where your socks leave deep dents that stay there, like your skin is holding fingerprints from the day. If that's you, then listen carefully, because that isn't a cosmetic problem and it isn't a harmless annoyance. It's your body sending a warning that your circulation is struggling to move fluid and blood upward against gravity, and every night you ignore it, you're letting stagnation become your normal. And when stagnation becomes your normal, the risk isn't just discomfort. The risk is that slow-moving, pooled blood can become the perfect environment for a clot to form. You don't need panic, but you do need clarity. Chronic swelling that pits and lingers is a message you should respect. Most people respond the way they've been told to respond. They elevate their legs and hope it drains. They cut salt and expect it to vanish. They soak their feet, drink some water, and assume tomorrow will be better. And sometimes those things help a little, but here's the problem. That approach treats what you can see while ignoring what's actually happening underneath. Fluid doesn't pool in your lower legs for no reason. It pools when the return system isn't keeping up, when the valves in your veins aren't pushing blood back to the heart efficiently, when the smallest vessels become leaky and inflamed, and when the body's fluid regulation is out of balance. That's why the swelling comes back every evening like a routine you never agreed to. Your day ends, gravity wins, and your legs pay the price. The real shift happens when you stop trying to reduce swelling and start trying to restore flow. Swelling is not the enemy by itself. Swelling is the scoreboard. The real game is circulation, vein tone, capillary integrity, and the pressure gradient that's supposed to keep fluid moving out of the tissues and back into the bloodstream so your kidneys can process it. The reason nighttime matters so much is because it's the only time you can reliably change the rules. When you're asleep, you're not standing, you're not battling gravity the same way, and your body naturally enters repair mode. That makes bedtime the perfect window to run a deliberate routine that doesn't just hide the symptom, but actively pushes the system back toward normal. Not with one trick. With a sequence that stacks small advantages until the overall pressure in your lower legs finally drops. But before anything else, one important note. Severe swelling, sudden swelling in one leg, warmth, redness, chest pain, or shortness of breath can be a medical emergency. And conditions like heart failure, kidney disease, liver disease, blood clots, medication side effects, and uncontrolled diabetes can all show up as swelling. So the smartest move is to treat swelling as something worth discussing with a clinician, not something to silently endure. What you're about to us. Should never replace evaluation when symptoms are intense or changing. The goal is to help circulation, not to gamble with it. Now, if what you're dealing with is chronic evening heaviness and pitting that improves overnight but returns the next day, then the most useful mindset is this: you're not just carrying extra water. You're dealing with a return problem, and return problems respond best to a combined strategy: internal fluid balance, mechanical pumping, and vessel support. That's why the routine is built like a system. Each part does something specific, and when you stack them, you give your veins and lymphatic flow an actual chance to catch up before you sleep. Start by setting the stage about an hour before bed with the most overlooked piece of the puzzle: electrolyte balance. People obsess over sodium, but sodium is only one side of the equation. The body's fluid balance is a three-way negotiation between sodium, potassium, and magnesium, moderated heavily by the kidneys. When potassium and magnesium are low, the body tends to hold onto sodium more aggressively, and when sodium is held, water follows. That doesn't mean eat no salt. It means the ratios matter, and deficiencies can make swelling stubborn. This is why some people cut sodium hard and still feel like their legs are filling up by the end of the day. The body is clinging to what it thinks it needs because the internal signals are distorted. The nightly setup here is simple. You're trying to support relaxation of vascular smooth muscle, encourage better cellular hydration, and reduce the tendency to retain fluid in the wrong compartment. Magnesium is commonly used for muscle relaxation and can support sleep quality for some people, and potassium is a major player in fluid balance. But supplementation is not harmless if you have kidney disease, are on certain blood pressure medications, or have heart rhythm issues. So you treat this like a serious tool, not a casual drink mix. If you're safe to use them, the concept is to take a modest, measured dose early enough that your body has time to process it while you're still upright, giving your kidneys a head start before you lie down. Then you move to the fastest visible shift, using temperature to create a pump effect. Heat opens vessels, cold constricts them, and alternating the two can create a strong push-pull response in the tissues. The reason this feels so effective for swollen ankles is that you're not waiting for your body to passively drain fluid. You're creating mechanical movement through vascular response. The hot phase encourages expansion and circulation toward the surface, and the cold phase forces constriction that can help push blood and fluid onward. People often underestimate how powerful the cold phase can be because it's uncomfortable and discomfort makes people quit early. But the entire point is to trigger that constriction response long enough to matter. When you repeat the cycle, you're basically telling your lower legs, you're not allowed to stay stagnant. You're giving the system a rhythm it can follow. After that, you take advantage of gravity in the smartest way. You put your legs up and you make them work. Elevation alone can help, but passive elevation can be slow, and slow doesn't always beat stubborn swelling. What changes everything is adding active ankle movement. Your calves are sometimes called a second heart for a reason. When they contract, they compress veins and help push blood upward. When you combine elevation with repeated flexing and pointing, you create a real, measurable pumping action. You're not just resting, you're draining. And you're doing it at the exact time of day when fluid has spent hours sinking downward and collecting in the tissues. The key is consistency, because chronic problems rarely respond to one dramatic night. They respond to a boring routine done repeatedly. 5 minutes can sound small, but 5 minutes of intentional pumping in the right position can do more than an hour of hoping. And it also gives you a diagnostic clue. If you do this correctly and the swelling barely budges, that's a sign you should not ignore, because it may mean the cause isn't just mild venous insufficiency. It may mean you need medical evaluation for deeper causes. In other words, even the routine can give you useful information about your body. Once you've drained, you focus on the tissues and vessel walls. Swelling isn't only about fluid being present. It's also about why fluid is escaping into tissues in the first place and why it's not being reabsorbed efficiently. Inflammation and vessel permeability can contribute to that leaky feeling, where ankles balloon more easily than they should. Many people like topical massage because it combines mechanical movement with a soothing ritual. The massage itself matters more than the oils. Upward strokes toward the heart help encourage venous and lymphatic return, and firm, consistent pressure can help move fluid out of the lowest pockets. If you use essential oils, they should be diluted properly because skin irritation makes everything worse, and swollen skin can be more sensitive. The bigger idea is that this step is not self-care fluff. It's manual assistance. It's you physically guiding fluid away from the area that traps it. Then you protect the progress while you sleep, and this is where a lot of people accidentally sabotage themselves. Compression can help, but only when it's appropriate for the situation. Too much compression at the wrong time can be harmful, and sleeping in strong medical-grade compression without guidance can create problems. The concept for nighttime is gentle, supportive pressure that maintains the reduced swelling without restricting circulation. Socks that leave deep grooves at the top are a warning sign, not a badge of effectiveness. You want graduated, comfortable support that doesn't act like a tourniquet. And if any numbness, tingling, discoloration, or pain shows up, you stop and reassess. The goal is assistance, not constriction. Next comes a habit that sounds innocent but can undo everything: late-night drinking. Not because water is bad, but because timing matters when your body already struggles with fluid distribution. If you pour a lot of fluid into the system right before lying down, your body may not process it the way you expect. Some people do better with shifting hydration earlier in the day and tapering at night, giving the kidneys time to do their work while the body is still upright and active. This isn't about dehydration. It's about strategy. Your legs don't need extra volume right before the position change that makes fluid harder to manage. You want your system calmer, not more loaded. And now you get to the long game element, supporting vein health from the inside. A lot of swelling routines are obsessed with immediate drainage, but the reason swelling becomes chronic is because the underlying structures don't hold up. Vein tone, valve function, inflammation, and capillary integrity matter. Some supplements are marketed aggressively for this, and the evidence varies. Horse chestnut extract is often discussed for chronic venous insufficiency, and so are certain antioxidant compounds. But supplements can interact with medications like blood thinners and can be inappropriate for certain conditions. The safest, strongest takeaway is not take this miracle pill. It's this: if you're going to use internal support, do it carefully, choose standardized products, and treat it like a long-term support strategy rather than a quick fix. The real win is when your evening swelling gradually becomes less dramatic because your daily baseline improves, not because you found a one-night trick. There's also one more hidden factor the script uses well. It points out a common posture habit that quietly blocks return flow. Leg crossing and certain sitting positions can compress major vessels and reduce circulation, especially if you already have a return problem. The value of mentioning this is that it gives people something they can correct immediately without buying anything, and it reinforces the message that circulation is mechanical. Your body isn't only chemistry, it's plumbing and pressure. The way you sit and sleep can either help flow or choke it off. Small posture changes, like keeping legs uncrossed or using a pillow between knees when side sleeping, can make the overnight result more stable. To make the ending more hooking and satisfying, you want to land on three things: reassurance, a clear action cue, and a reason to keep following you. Reassurance means you acknowledge that swelling is common and often improvable, but also serious enough to respect. The action cue means you tell them exactly what to do tonight in a simple, memorable way, without making them feel overwhelmed. The reason to keep following you is a clean tease that doesn't feel like clickbait, something that logically comes next, like the daytime habits that undo the nighttime routine, or the signs that swelling is something more dangerous. Here's the close that ties it together and keeps people engaged. Tonight, don't make this complicated. Your mission is simple: move fluid, restore flow, and protect your progress while you sleep. Start earlier than you think because timing is part of the treatment. Support your internal balance, use contrast to wake the vessels up, pump the calves like you mean it, massage upward to guide the fluid out, and keep gentle support overnight instead of strangling pressure. Then cut the late-night fluid loading that makes your ankles pay for your evening habits. Do that consistently for a week and track what changes: how deep the sock marks are, how tight your skin feels, how flexible your ankles are in the morning, and how fast the heaviness returns the next day. If the swelling is worsening, becoming one-sided, painful, hot, or a sciated with breathing issues, don't troubleshoot it with internet routines. That's your sign to get evaluated quickly. But if your swelling is the chronic, every evening kind, this is how you begin taking control of it instead of surrendering to it. And one final thing: if you want this to be permanent, your bedtime routine can't be the only defense. What you do during the day either protects your veins or quietly stretches them out. In the next piece, I'll show you the everyday foods and daily habits that stiffen vessels, worsen inflammation, and make fluid retention more stubborn, even if you do everything right at night. Because the goal isn't to survive your evenings. The goal is to get your legs back.